Dear Commissioner, Minister, dear guests, cancer is the second most common cause of death in Europe. Under its Council presidency in 2008, Slovenia put forward this issue in order to reduce this huge burden. We strongly believed that we could tackle it best by working together. The Slovenian initiative gained broad political support. The Council conclusions adopted in June 2008 on reducing the burden of cancer requested that the Commission and Member States work on developing a framework of comprehensive policy response. The Commission communication on action against cancer in 2009 outlined the skeleton of the European Partnership for Action Against Cancer. The underlying idea was synergy, a collective approach to one of the major health threats in Europe, cancer. The partnership represents a new model of cooperation, bringing together not only member states, but a wide range of additional partners into a joint commitment to fighting cancer. I'm happy to say that the European Partnership for Action Against Cancer is fully operational. It is a great pleasure and also a challenge for me personally and for Slovenia to lead this initiative. I would like to thank all the partners who have taken on concrete responsibilities with the partnership and who contribute actively to the implementation of the agreed activities. This is essential for the success of the partnership. I would also like to thank the Commission services for all the excellent work and the contribution they have provided to the partnership. The partnership has set itself very ambitious goals. Yearly open forums provide the opportunity to review how far we are in achieving our goals. The partnership aims to identify and assess the best practices from across the entire spectrum of cancer-related health policies, from health promotion, prevention, screening, integrated cancer care, rehabilitation, palliative care, and research, focusing on the patient's perspective. The Open Forum held in Madrid last year looked at the best practice and solutions in the area of cancer-related healthcare and research. Today and tomorrow we will focus on health promotion and cancer prevention and data and information. Our goal be to prevent the preventable, because at least 1/3 of cancer can be prevented. It has been proven that disease prevention is the most effective and hence strongest means of reducing the burden of cancer in every country and at community level. All existing knowledge and methods must be used to this end and implemented in all policies with involvement of all stakeholders. In the area of information and data collection, population-based cancer registries are of the utmost importance. At this point, I would like to mention that Slovenia is proud to have one of the oldest existing cancer registries. European cooperation among cancer registries is important for defining data collection standards and regular dissemination of information of incidence and mortality from cancer in the European Union. To ensure accurate and comparable data on cancer incidence, prevalence, morbidity, survival and mortality in the European Union by 2014 is one of the important aims of the European Partnership. I'm very glad that this important field of the European Partnership is coordinated by our partner from Italy, and I would like to take this opportunity to commend them on the excellent work they are achieving. I would like to mention two very important issues. The first is screening programs. Although the European Union issued a Council recommendation on cancer screening in 2003, many countries face difficulties in the implementation of these recommendations. The partnership will help to alleviate key barriers in implementation of the Council recommendation to make screening accessible to all citizens who may benefit from it. Another important issue are national cancer plans. A specific activity within the partnership is developed to work on the development and/or implementation of such plans. Many countries, including Slovenia, have already adopted national cancer plans. The aim of the partnership is, by sharing experiences and best practices, to identify key elements of the national plans which bring about successful implementation. The cancer plans will be discussed at the last Open Forum conference, which will take place next year in Slovenia, where the idea of partnership was born. I would like to take this opportunity to invite you all to be our guests in Slovenia next year and discuss the results of the partnership. I would especially like to extend my invitation to the colleagues with me here today. Thank you for your attention, and thank you again for this invitation to speak at the second Open Forum of the Partnership for Action Against Cancer. I'm convinced that the program will inspire cancer stakeholders from across Europe to further gather their efforts and continue to work together to implement the partnership's goals and objectives. Thank you for your attention.